Dr. Joe Phaahla says although the third wave is still upon us, he's encouraged by the decline in the daily number of COVID-19 infections. Phaahla was leading his first COVID-19 briefing as Health Minister this morning. He was joined by a panel of experts to unpack the response to the COVID-19 pandemic and the vaccine rollout program.
The third wave is indeed still upon us. We're still going through very difficult times in terms of the third wave. As of over the last 24 hours, there were 13,777 new cases of COVID, a slight increase compared to the day before, which was 13,263. And in this regard, we remain concerned. It's quite clear that the third wave is taking no different pattern, but very similar pattern to the first and second wave.
Meanwhile, Phaahla has raised concerns over the rising number of infections in the coastal provinces. The minister is expected to visit the Western Cape soon to assess the situation.
Just similar to previous, the first and the second wave, we can see that when the epicenter starts in a particular province, and then from there the surge moves into different provinces, and we can see now that it's moving into the coastal area. The Western Cape has been, over the last 7 days, the Western Cape province overtook Gauteng province as the one with the highest numbers, the new epicenter. Yesterday was the same, with over 4,000 new infections. We are very encouraged by the fact that Gauteng has been declining, but we can see also that at the same time, as I mentioned, the coastal KwaZulu-Natal is also rising, and also in a way the Eastern Cape is also rising, even though not at a very steep rate.
In some positive news, the Health Minister says by the end of August, the country will have received around 20 million doses of the COVID-19 vaccine.
We are very pleased with the fact that we are remaining over 200,000 and approaching 250, and hopefully very soon reaching the target set by our President of 300,000 vaccinations per day. I must acknowledge that we did have a dip in the last week, where we had a shortage of a supply of vaccines, but I can assure members of the public that this has now changed. Over the last few days, we are very pleased to inform the public that our vaccine supplies have now stabilized. As we speak to you this morning, we have over 10 million doses of vaccines in our storage, in our fridges. In August alone, we expect to receive by the end of in the month of August, when August ends, we will have received over 20 million doses of vaccines.
The Health Minister says considerations are underway to bring back the AstraZeneca vaccine. He says COVID-19 Minister Advisory Committee is still studying the recommendations further.
I can also just add that in our last National Coronavirus Council meeting, our Vaccine Ministerial Advisory Committee did make a presentation, and following that discussion, the NCCC, on behalf also of the Interministerial Committee, which did not sit this week, will be sitting next week. After that presentation, it was also approved that within our arsenal, we must also include the Sinovac vaccine, which has been conditionally approved by the South African Health Product Regulatory Authority, but also that the AstraZeneca vaccine, which have now been shown to be effective against the Delta variant, that we should also look at bringing it back into use.